Assalamu alaikum warahmatullahi wabarakatuh. Welcome to the 9 p.m. English News Edition. Here are the top stories. For the international news, Europe continues its deconfinement. Hello, welcome to our newsroom for having the news in details. The General Secretary of Health, Dr. Salah Bin Turab, has made this daily press briefing on the situation COVID-19. The situation of the epidemic in Djibouti is as follows. 813 tests were performed, 117 cases positive to COVID-19, 46 cases cured, and unfortunately 3 deaths. The measures planned at the level of health centers and hospitals will be reinforced by the compulsory wearing of masks and systematic hand washing for consulting and accompanying persons. It is important to stress that no consulting and accompanying persons will be admitted to a health structure without a medical or craft mask. However, the chain of community transmission of the COVID-19 virus in a lasting and definitive way will inevitably pass through the application of the government's instruction in terms of protection and prevention of the infection. In terms of the overall balance, 18,345 tests carried out, 1,518 positive cases of COVID-19, 1,018 confirmed cases cured, 7 deaths in total. Please stay home and apply barrier measures. Prime Minister Abdul Qadir Kamil Mohammed shared the late morning meeting with the steering committee to fight against the COVID-19. This restricted meeting of the steering committee of the fight against the COVID-19 was devoted to the establishment of a mass screening campaign which aims to conduct a total of 5,000 tests per day. Tests that will take place in health centers, CDC, and hospitals. This meeting was attended by the Minister of Communication, Ridwan Abdullahi Bahdoun, the Minister of Muslim Affairs and Property Waqf, Mumin Hassan Bare, and the Minister of Labor, Ismail Ibrahim, and finally, the Minister of Social Affairs, Muna Osman. At the end of this meeting, he gave us an interview on the ins and outs of the new mass screening campaign. The Prime Minister, let's listen to him.
Un dépistage massif aura lieu.
Massive screening will take place in the city of Djibouti, especially in health centers. Sampling will take place at the CDC. I urge all Djiboutians to get tested, especially the elderly. COVID-19 is a serious disease. Today we are at 7 deaths, and it seems that the death rate is increasing day by day. So it is very serious. We all need to get tested. For those who test positive, have not responded to healthcare workers for treatment, and that's even more serious. People who test positive have to go to the treatment centers very quickly and contact the healthcare workers at the Ministries of Health. Those who test positive are in constant danger to the public and are not treated in time because they deliberately endanger the lives of others, and this is punishable under the Penal Code. Otherwise, those who test positive and do not respond quickly to healthcare personnel will be brought before the courts. Be careful, respect barrier gestures. Thank you.
Respecter.
Prime Minister Abdul Qadir Kamil Mohammed yesterday received a courtesy visit from a delegation of Italian army stationed in Djibouti. The meeting took place in the Prime Minister VIP lounge. During the discussion, the two men discussed bilateral cooperation and the long-standing relationship and of friendship between the two countries. This morning visit provided an opportunity to discuss the friendly relations between the Republic of Djibouti and Italy. This visit was also an opportunity for the Prime Minister to discuss with the delegation to strengthen of cooperation between the two countries in various strategic areas. Concluding now its mission of parliamentary information and control, the Committee for Support and Monitoring of the Fight Against the COVID-19 held talks with the Minister of Trade and Minister of Interior on Monday, 18 May. The agenda of this committee, shared by Honorable Ahmed Rabli Abdullah and in the presence of his fellow members, began with the meetings of the Minister of Trade Hassan Ahmed Ibrahim, assisted by his closest collaborators. The audience reviewed issues such as the action carried out on the ground in recent weeks by the ministerial department in charge, among others, of the caution of any price inflation which would be caused by anti-commercial practices. In this regard, the audience discussed the issues and challenges posed by the containment and subsequent the confinement, food distribution, the national emergency plan, including the RSEC plan and its counterpart to be implemented during natural disaster, such as the last rains or the outbreak of a public health hazard such as the pandemic currently affecting the planet. Now, the solidarity is traditionally a social and moral duty, especially in this blessed month of Ramadan, when the population has been greatly destabilized by the socio-economic consequences of the COVID-19 pandemic. It is in this perspective that the National Union of the Djiboutian Women, UNFD, under the leadership of the First Lady and the President of the UNFD, Her Excellency Mrs. Khadra Mahmoud Haid, proceeded this Sunday, May 17, 2020, at the primary school of Balbalawan to the distribution of dignity kits to the families most affected by the recent heavy rains. Thus, 500 kits consisting of clothes and shoes for men and women, as well as Eid al-Fitr, clothes for children were distributed. All beneficiaries also received impregnate mosquito nets with support of the Ministry of Health. Now, within the framework of social assistance program and activities during the blessed month of Ramadan, the regional office of the NGO Rahma International and the state of Kuwait in Djibouti has been implementing the project to distribute food to the inhabitants of Djibouti city and the interior region since the beginning of Ramadan. Hundreds of poor and low-income families have benefited from this humanitarian gesture and have received sacks of rice, sugar, flour, and oil. The total number of food baskets distributed by the NGO to date is 2,000, and the food aid was distributed to the neediest family in the presence of the project manager of the NGO Rahma, Mr. Elmi Yusuf Tahir, the project and program controller, Mr. Khalid Abdul Harag, and the local authorities. It should be noted that the regional office of the NGO Rahma is an important partner for the government in the advancement of health, education, and social areas. Now, still within the framework of the fight against the COVID-19 among young people, the collective of Association of the Arta region, Duda Demirjog Sub-Prefecture, organizes a community social action to prevent COVID-19 with the financing of the Associate PMF and Microfinance Program and the Global Environment Fund. The collective of Association of the Arta region, Duda Demirjog Sub-Prefecture, organized a ceremony for the reception of the materials for protection against the COVID-19 virus by the Associate PMF Program and the Microfinance Program Global Environment Fund. The donation ceremony also saw the participation of representatives Program Association, PMF, RMF, and the Microfinance Program and the Global Environment Fund, Mrs. Filson Abdi, and the president of the collective of association in Arta region, the Sub-Prefecture Duda Demirjog, Madam Huda Said Ali, and her deputy, Sarada Said Jama. This action is part of the fight against the COVID-19 in our country with the participation of young volunteers from the Demirjog and Duda. The young inhabitants of the Demirjog and Duda benefited from this important material for the fight against COVID-19. Wearing masks and hand gels are preventive measures that all Djiboutians must respect in order to reduce the spread of COVID-19 in our country. At a time of the confinement, protective equipment is very important. Now, for 2 months in confinement decreed by the President of the Republic on 23rd March to stop or reduce the spread of the deadly coronavirus, the daily links between the capital and the Djibouti city had become almost nil. Sunday, May 17, at the bus station, the confinement is solemnly celebrated. Very early in the morning, as usual, the first buses leaving for Djibouti are made available to passengers. The inside and outside of the buses are disinfected by agent of Djibouti Red Crescent, a branch of Al Sabih in a white suit. A few moments later, before boarding this means of public transport, the passengers were asked to scrupulously respect the barrier gestures, hand washing with anti-freeze, social distancing of 1 meter, and use of a mask and the sanitizer. The resumption of road traffic towards the capital is particularly welcomed by the Asajok. The launch or standardization of this event saw the participation of the region's security corps. The head of the Al Sabih National Police and National Gendarmerie Detachment Corps were keen to be present or to supervise this normalization of bus travel to the capital. In the city center, another checkpoint is set up by men in uniform for a final check before leaving the city. Any means of public transport whose passengers do not wear masks are turned back. Little by little, with the control and the requirement of the police forces, the Asajok adapted the barrier gestures and the wearing of masks. Still in the same context, in the framework of the fight against the COVID-19, the spread of the coronavirus, in the morning of Thursday, 16 April, the UNFD proceeded to distribution of the living allowances granted by the First Lady, Mrs. Khadra Mahmoud Haid, to 500 vulnerable families. In the white city of Tajura, the regional branch of UNFD and the regional office of the Ministry of Women and Family have proceeded to the distribution of food to mothers and vulnerable families. It is this morning of Thursday, 16 April, at the Women and Family Empowerment Center, in the presence of Deputies Ummah Mohammed Hamid, Ahadi Debarkala, and Vice President Hassan Al Yusuf, local elected officials, that this distribution operation took place in favor of 500 poorest family, disabled, and widows. This food distribution was carried out within the Women's Empowerment Centers, where a kit containing rice, flour, sugar, oils, tomatoes, tea, etc. is designed to protect our vulnerable families against any risk of contamination with COVID-19. The women of the UNFD of Tajwa joined all the beneficiaries to express their sincere thanks to the First Lady, Mrs. Khadra Mahmoud Haid, who launched this wave of solidarity towards the needy Djiboutian women here and everywhere in the country. Moving now on the international news, some of the Europeans experienced a first weekend in the street of capital just like in France, a real breath of fresh air that had been awaited for weeks, yet it is a relative freedom. More details with Dini Musa.
Opening this exceptional video conference meeting, attended by 194 countries, Chinese President assured that a possible Chinese coronavirus vaccine would be a global public good. While waiting for a cure, the world is trying to revive strangled economies. Even as the coronavirus advances, particularly in Brazil, India and South Africa, and the specter of a second wave looms. In Italy, one of the countries most bereaved by the pandemic that left China at the end of 2019, and the first to have adopted total containment of its population, the time finally came on Monday to enjoy a coffee on the terrace. Japan, the world's third largest economy, confirmed on Monday that it had entered recession. Like several countries before it, it also announced the closure of the emblematic Mount Fuji to hikers because of the coronavirus. In the United States, the head of the central bank, Jeremy Powell, estimated that the fall of activity would seek easily in the 20 or 30%, and the unemployment could peak at 20 or 25%. In a country where social protection is limited, but he pointed out fundamental differences from the Great Depression of the 1930s, as states were better equipped to deal with the crisis.
This is it for this edition of 9 p.m. Thank you for watching us and have a wonderful night.